Hey there, I'm Dr. Amy, and we're going to talk a little bit about dentistry today. What tends to happen when people talk about dentistry is they get out a skull or a horse or something. But the bottom line is, the really important part about keeping a balanced dental arcade in your horse turns up right here in the riding ring. And when we see these horses move, their ability to balance, their ability to move forward, their ability to use their hind end as impulsion, their ability to answer the cues that you are giving them when you want them to ride, all comes down to how well balanced they are. And if their jaw is not balanced, if their hyoid's not balanced, if they're having muscle spasm because their jaw is held to one side, if they are imbalanced in their mouth, they may not respond to the bit cues that you're giving them. They may overreact to any kind of cues your hands tend to give them, and they won't be able to carry you forward or carry you over a jump as cleanly as they should. They may be impeded in those efforts. So really and truly, when people say to me, "Oh, my horse isn't dropping grain yet, I don't think he needs a dental," that's not even close to half of the battle. Here in the ride ring is where it all starts, or when you're out trail riding, or when you depend on that horse to balance you, because dental balance is really about all over horse balance. As we watch these horses go around the ring, we can see that they're responding, or trying to respond at least, to what these riders' cues are giving them. But what we oftentimes see, as we see in some other rings, horses that can't put their head down, so they can't see forward because their jaw won't let them. They aren't able to round, so they're not able to round their back, which means they're not able to use their hind end to push them forward. All of these come back to being able to balance that mouth. So if the mouth is not in balance, and I don't mean necessarily sharp points, but unlevel teeth, teeth that are worn unevenly. And when we mean unevenly, we mean not just from tooth to tooth, but also from side to side. When we talk about unevenly, we talk about, are the incisors even? If the incisors are giving a smile, which we'll look at later, then the rest of the mouth can't possibly be balanced either. So all of these things affect the muscles and the nerves of the head and neck and the way it carries the horse. And if we think about that head and neck as a giant pendulum on the front end of the horse that weights the back end of the horse, then we can start to remember that everything is connected. And because it's all connected, it has to be in balance, like a teeter-totter. It has to be able to travel evenly, or we unweight it one direction or the other. And what this does is makes our horse have a difficult time balancing its rider and moving forward. So we're going to look a little bit more closely at dental balance and talk about how frequently, how often we need to have teeth floated or balanced, and also talk about some cues that tell you before he's dropping grain on the ground whether he needs to have his teeth checked or not. Some of this has to do with age, season, what he does during the day, what kind of food he chews and how. So let's take a closer look at dentistry in terms of the whole horse. And now that we've talked a little bit about teeth balance and the importance of balance in terms of riding balance and the horse's ability to carry you on his back, and the importance of how these teeth can affect not just the mouth, but the balance of the rest of the body and other structures in the body, what we'd like to do, we've taken Oliver and we've balanced his mouth. We floated his teeth so that we don't have a side-to-side imbalance in the teeth anymore. We've given him a 15-degree angle on his molars, and we've taken those points that were causing him some trouble and put them back into that normal mouth movement. He's a little sedated still from his teeth float, but what that's going to let us do is to mess with his mouth a little. And as I move it back and forth, I can get normal motion from side to side with his jaw, both directions, not just one. And as I listen, you can do this with your own horse, I can hear his molars making contact on both sides all the way up the side of the mouth. We're going to take a minute here and put a speculum in, and then we'll take a look on the inside so that you can see where those teeth sit. When we float their teeth, especially when they have the kind of pathology that he's had, we can't always make those changes instantly. Sometimes it takes a couple of teeth floats to get the mouth back into balance so that he can use this head the way he needs to. But what we've done is given him more balance. What we now can do, one of the things other things you can do to check your horse is look at muscle structure on the sides of each side of his jaw. Oftentimes we'll see horses that have a larger masseter muscle on one side than the other. This lets us know that they are not chewing evenly and that their temporomandibular joint is being overworked. When we have pain in this joint, then we have problems with balance. We have problems with sensory input to the brain. And pain in this joint can make a horse very grumpy and very uncertain of himself. One of the symptoms we see in particular when horses are not working well, when their dental work or their head is not balanced, are things like messing with their bit, holding their head to the side, chewing on the bit. And as you see with this guy, holding his head up in the air, rather than rounding in the front and balancing his back end, you can see he doesn't have good impulsion from behind. And that all comes from the fact that he's got his head tipped up in the air. And he has his head tipped up in the air because his teeth are keeping him from being able to round his head and drop his jaw. If his jaw can't slide forward, he's not able to drop that head. And so he's all strung out in the back. He can't get his hind end up underneath him, no matter how hard his rider tries. So these are things, horses who you have to hold in a frame, horses who are difficult to hold in a frame, horses who don't balance their head. You can see he turns from side to side because he's unable to give his rider the kind of balance he needs. These are all symptoms that his teeth are not balanced. Even in this pony, we can see that he holds his head up in the air rather than dropping it and rounding it. And those are definitely symptoms that, for one reason or another, their teeth are not balanced and they're not able to use their jaw